Thank you. The next question is cancer screening test. Any benefits in?
Yeah, of course. Early detection is the key for anything at all. And early detection is the key. So if you can get screened to detect something early, taking care of that is better than just like Dr. Nema said, waiting for the disease to show up. So also is with cancer. Right here in the US, there are two different guidelines out there. That is one by American Cancer Society, which most people pay attention to. And they focus mostly on early detection, when to do your mammogram, your colorectal screening, PSA, those kind of things. There is also the United States Task Force. Their own guideline is mostly they're looking at costs. But somehow there are some of their recommendations that appears also to fall into the early detection. When that happens, then you tend to see most clinicians pay attention to it. Bottom line is, mammography would detect breast cancer early, pap smear would detect cervical cancer early, colonoscopies and all that stuff would get you earlier to be screened and to, quite frankly, get to know when to. Now, if you're looking at specific guidelines for breast cancer, the recommendation is once you turn 40, you should start your annual breast cancer screening. And that's the American Cancer Society guideline. The U.S. Task Force recommends instead of doing it annually, you do it every other year. And again, most people will start their mammography at the age of 40. When it comes to rectal cancer and all that, the recommendation is again at 45, especially if you are of a Black or African American origin or heritage. That would be the time to start, and that could be it could be a stool screening just to see whether you have any blood in your stool, or it could also be a digital rectal exam, which could be done by your physician. And if any of those turns out to be positive, then you need a colonoscopy to see what else is going on. And depending on the findings on the colonoscopy, if they find a polyp that looks like it's abnormal, they biopsy it and keep an eye a little bit sooner on it, as against much later. For cervical cancer, so once you're sexually active, but the guideline says 25. The United States Task Force is looking at maybe doing that a little bit earlier. That requires a pap smear or an HPV test on its own, or the so-called co-test, which is where you bundle both the pap and the HPV at the same time. There is also for prostate cancer. We talked about it. It's one of those that there's really not much of a clear guideline onto it, except that once you hit 45 and you're of that age group, African Americans or have a family history of cancer, then you want to start early at 45 to start getting your PSA. With or without the digital rectal exam. But otherwise, most of prostate cancer screening has to be a discussion that you have to have with your healthcare provider. If you are a smoker, you also need to be screened for lung cancer, especially if you smoke for more than 20 pack years, which is pretty much saying that you smoke a pack a day. And if you do that, whether you smoke or you are still smoking, and you looked at that you smoke for more than 20 years, on average of about a pack a day, I'm sorry, then you need to have a CAT scan, and it's called a low dose CAT scan, which is a much lower dose of radiation, but just to see whether there is a a chance of running into a spot in your lung, which would either want to do a biopsy or keep an eye on, or those kind of things, So those are the basic cancer screening out there. But the bottom line is, think early, get on it as early as you can. Most of these are paid for by most insurances, and early detection is a key.
Right. Thank you. That was
I would like to add that or reiterate the fact that if there's any of these things in your family, previous history, the detection now means that your screening is advanced 5 years ahead. So instead of waiting for 40 to start your breast examination, you're going to start at 35 if you have a positive family history of that. Same thing with the colonoscopy for colorectal issues.
how